Thank you for joining in. Today we will talk about chronic bronchitis. I am Monica Clark.
Hi, I'm Luis Carmona.
Hi, my name is Mary Lisa Castillo.
Hi, I'm Jackie Chestnut.
Today we'll be covering the following objectives about COPD. The definition of COPD, signs and symptoms, epidemiology and stratification, risk factors and prevention, detection, evidence-based treatment and management, dimensions of health, spiritual and emotional support, rehabilitation goals and services.
What is chronic bronchitis? It is a lung disease that makes it hard to breathe. Take a moment and imagine needing to consciously think about every breath that you take for minutes, hours, or even days. Chronic bronchitis is the inflammation of the lining of the airways or bronchial tubes. Chronic bronchitis is a type of chronic obstructive pulmonary disease known as COPD. Chronic bronchitis is the presence of a chronic productive cough for 3 months in each of 2 consecutive years in a patient, with other causes of chronic cough excluded. People often ignore the signs of chronic bronchitis until it is well advanced. Signs and symptoms: cyanosis, weight loss, wheezes, decreased breath sounds, dyspnea or hypoxemia, muscle weakness in the upper extremities or lower extremities. Dyspnea is often progressive and usually occurs with exertion. In the late stages, dyspnea may be present at rest. Wheezing and chest tightness may be present, but may vary by the time of day or even from day to day. An estimated 12.1 million adults in the United States over the age of 18 have COPD. The number of women with COPD is increasing. COPD is the 4th leading cause of death in the United States. More women die from COPD than men. More white Americans are likely to have and die from COPD. Death rates related to COPD for Hispanics are lower than any other ethnic group. Worldwide, it is predicted that COPD will become the 3rd leading cause of death by 2020. Let's take a look at some of the risk factors.
Chronic bronchitis may occur after an upper respiratory tract infection, for example, the influenza. People exposed to industrial dust and fumes in the workplace, such as coal miners, are also at high risk for developing this disease. However, cigarette smoking is by far the most common cause of chronic bronchitis. Next, we will mention some preventative measures.
Prevention for COPD, the best way to prevent is to never start smoking. If you currently are a smoker, you need to quit smoking as soon as possible. Other ways to prevent COPD include to avoid indoor pollution. This means that indoor cooking and heating with biofuels without ventilation and secondhand smoke can cause COPD, so you want to stay away from this. Also, you want to protect your lungs from occupational dust and chemicals. So you want to wear your proper personal protective equipment while at work. You also want to try to avoid outdoor pollutions as much as possible.
Detection. To detect chronic bronchitis, the healthcare provider will ask questions about your medical history and your symptoms, such as whether you have recently had a cold or the flu. He or she may also ask whether you smoke or are exposed to smoke or other lung irritants, such as air pollution, dust, or fumes. The healthcare provider will listen to your lungs with a stethoscope to detect abnormal breathing sounds, such as wheezing. Other possible tests include a chest x-ray. The chest x-ray can differentiate acute bronchitis from pneumonia. Sputum culture. This test can check for presence of bacteria in sputum produced when you cough. It is helpful to determine whether the illness can benefit from the use of antibiotics. Pulmonary function test. During a pulmonary function test, you blow into a device called a spirometer, which measures how much air your lungs can hold and how quickly you can get your airs out of the lung. Bronchitis is diagnosed based on your physical symptoms and by ruling out more serious illnesses such as pneumonia. Next, we will talk about evidence-based treatment and management.
Treatment and management for bronchitis includes, first of all, the most effective and cost-effective way is to quit smoking. Secondly, there are 4 levels of chronic bronchitis: mild, moderate, severe, and very severe. So for mild cases of chronic bronchitis, treatment will begin with short-acting bronchodilator medication through the inhaled route. Such medications include albuterol and Atrovent. Secondly, regular physical activity is always encouraged to patients with chronic bronchitis. Fourthly, a yearly flu vaccine helps prevent flare-ups of chronic bronchitis episodes. For moderate and severe treatments of chronic bronchitis, it includes long-acting bronchodilators inhaled route, such as Ceravent or Foradil. Continuing to severe cases of chronic bronchitis, we get into the use of corticosteroids inhaled route with medications such as Flovent or pill form corticosteroids. For very severe cases of chronic bronchitis, we will start using long-term oxygen therapy at home, and lastly, surgery.
Chronic bronchitis can affect different aspects of the health. For example, physically, patients experience shortness of breath, wheezing, and heart problems, leading to swollen ankles and feet. Emotionally, it can have a negative effect, causing failure to thrive, and socially, it can interfere with your ability to work and causing a strain in the family. It is important to see your clinician regularly so that any new problems can be caught early. Next, we will be talking about spiritual or emotional support resources for individuals and families.
Joining a support group can help individuals with bronchitis and their caregivers spiritually and emotionally by teaching them ways to cope with their disease and ways to enjoy a better quality of life. Joining support groups can lead to empowerment, education, and socialization. Empowerment can be gained because living with chronic bronchitis can cause anxiety and depression. Joining a support group can give you a sense of control and empowerment over your health because you will learn ways to better live with bronchitis. Your education can be increased because support groups provide valuable information, members share their experiences, and because meetings are usually conducted by healthcare professionals who can answer your questions. Your socialization is also increased by joining a support group. You get to meet people who understand your health issues. Interacting with other people who know what you're going through can help relieve psychosocial and emotional stress. Because so many people in the United States are living with bronchitis, there are many resources out there where individuals and their caregivers can find help. The Better Breathers Club is a support group for adults suffering from chronic lung disease, including bronchitis. This group is organized through the American Lung Association. Club members attend monthly meetings to share their experiences, knowledge, ideas, and strengths. Meetings include expert speakers, video presentations, and roundtable discussions. Individuals who attend the Better Breathers Club get the opportunity to learn ways to better deal with their disease. The Better Breathers Club is a national club that has many local clubs all around the city of Houston. Listed on the screen are different clubs around Houston. Online support groups are convenient for those individuals who don't have transportation or the time to physically meet with other individuals. From the convenience of your own home, you can get tips on ways to live with bronchitis, healthy and active living tips, and also discuss anxiety and depression. Most online support groups allow you to chat live with other members and healthcare providers. On these online groups, you can also join forums, watch videos, join mailing lists, and find out more information about the disease, including treatment and rehab. Some online groups are with the COPD Foundation, the National Heart, Lung, and Blood Institute, and the American Lung Association also has a helpline you can call. Breathing retraining is done to decrease dyspnea, improve oxygenation, and slow the respiratory rate. A common breathing exercise is pursed lip breathing, which prolongs exhalation and gives you control over your breathing, especially exercise and periods of dyspnea. Luis is going to demonstrate how to do pursed lip breathing. Okay, so you're going to take a deep breath and you're going to blow out for 4 seconds through pursed lips. You would repeat this 7 to 10 times, 3 times a day. The goal of rehabilitation is to improve the diagnosis, treatment, and care of bronchitis, and to improve the quality of life of those living with the disease. Goal is achieved with breathing retraining and airway clearance techniques. Pulmonary rehab is a medically supervised program of education and exercise classes that teach you about your lungs and your disease, and how to exercise and be more active with less shortness of breath. You can become stronger by getting into better shape, allowing you to lead an active life. The programs usually last a few months. You will also learn exercises and breathing techniques. You'll also get tips on conserving your energy and advice on nutrition and coping. Thank you for joining, and we hope that we have expanded your knowledge on chronic bronchitis. For further details, you may visit www.americanlungassociation.com.